evening, ladies and gentlemen, good friends. My name is Jim Morris. I'm Vice Chairman of Pacer Sports and Entertainment, but more importantly, it's my pleasure this evening to be the honorary chairman of Timmy Global Health's remarkable celebration of 20 years of extraordinary service to people all over the world.
Timmy Global Health is celebrating its 20th anniversary, and I say more power to you, Timmy. This is an endeavor that means so much to individual persons who are going to be served frequently by young Americans who go abroad. But likewise, it makes a big difference in terms of our national security, the security of all of us, because in fact, we are a part of a world that has infections, that has viruses, that has need really for the service that Timmy Global Health provides.
Well, I can't believe it's been 20 years. I remember when Timmy Global Health was actually Timmy Foundation, and I was sitting at my kitchen table making phone calls to India in the middle of the night. I knew it was going to turn into something great because of what we could offer people, but at the same time, I can't believe it's been 20 years.
For 20 years, Timmy's impacted the lives of thousands of patients who would never have access to this kind of medication or this kind of care. They couldn't get their surgeries. I mean, it just makes such a difference in people's lives that there's nothing else like it.
Chuck and I have become good friends. One great thing is the Nigerians call him Chief Dr. Chooks, and so I can yell Chooks across a crowded room and he knows exactly who's yelling at him.
You feel the sense of need once you get there, and then you're thrust into the clinics and you see, okay, I can have, you know, a tangible role.
David Santangelo, one of our students who has cerebral palsy himself and wears braces on his legs, 11 years old, he sat on the board of Timmy Global Health. He did 2 trips to Ecuador, and on one occasion I was telling a mother that her son would walk one day. She couldn't imagine that was possible. But I explained that with certain medication and some leg braces, this was possible. And she's looking at me in disbelief. I opened the door to the hallway and I said, David, could you come in here? David walks in, pulls up his pant legs. Now it's more real than it could have ever been for her. And then as she cried, her son reaches up and touches the tears on her cheek and go, that's why we do this work.
In March, I'm doing a trip with a student who went with me to Jamaica in 2004 or 2005. She was an art major. Once she'd been there and seen what it was like, she said, I'm changing and I'm going to medical school. Sorry. And she's going to be on this trip with me because she's a doctor now. So that's the kind of impact we make on people. They're great. The students are great.
One of the things that I love about Timmy is that it invests in the health of community members right now, and it brings immediate care, but also that it looks at what is driving the biggest health problems in communities, and then focusing on those problems as well.
With Timmy, we're out looking for our brothers and sisters, and we're finding them everywhere, and we work with them, we heal them, and we have great friendships and great families globally because it's a different approach about how we see the world.